oblongata.
Crayon in the frame.
All right.
Oh. It seems like the number of Simpsons episodes out there are endless. So, with all that said, we're back at it with another Simpsons reaction. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy what you see here on this channel, smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. Oh! Oh! Bart! Skateboard injury.
Hurt. Oh, for crying out loud!
Yeah, not wearing a helmet. All the different things on wheels, because we can slip, fall, hit our heads, and it's dangerous. You can crack your skull open. It's not worth it. There's so many cool helmets out there. Wear something cool, enjoy it, and be safe, okay?
Just give him a nickel and let's get going. I think we should call an ambulance.
Oh, jeez, a hit and run. No.
Bad news!
Yeah.
Your son is a very sick boy.
That's horrible. A doctor should never walk into a room saying, bad news. That is not cool. You need to go in with what we call a good bedside manner. You walk in saying, hey, we've done all these studies and this is what we have found. And then if it's bad news, you follow it up with, this is what we're going to do and this is the next step.
Just look at the x-rays. You see that dark spot there? Whiplash.
Whiplash? Oh no!
What?
And this smudge here that looks like my fingerprint? No, that's trauma.
You can't see the findings that he's suggesting on an x-ray. When you're doing an image where somebody has whiplash injuries, you're looking for fractures of the cervical spine.
Am I gonna die?
Yes, son!
Homer!
With all due respect, Mrs. Simpson, you're not a doctor. The boy's not a doctor. I'm not a doctor. The only person in this room who even comes close is this man.
Stop! You're embarrassing me.
Doctor, are you sure there isn't a little soft tissue trauma in the facial area?
Oh, yeah, tons of it. Just say when.
Oh my gosh. I get to experience and see a lot of people that come in from minor car accidents, minor injuries, and you get into situations where people want to sue another individual for an accident. But we're there just to treat the patient, not the situation potentially that brought you to our facilities.
You have an absolutely unique genetic condition known as Homer Simpson syndrome.
Homer Simpson syndrome. What is this? This is great. I gotta see what this is.
Brain is cushioned by a layer of fluid 1/8 of an inch thicker than normal. It's almost as if you're wearing a football helmet inside your own head. Why, I could wallop you all day with this surgical 2x4 without ever knocking you down.
It happens as we get older, the brain tissue actually shrinks. Isn't that crazy? The other question ends up being, is that on purpose that we were created that way? Because as we potentially get older, we increase our risks of falling with head trauma, which then increases our risk of bleeding in our head. So the fact that you now have more space inside your skull to bleed without it compressing onto your brain itself is actually beneficial. Uh-oh. Whoa! It's like a razor blade.
Bart!
Oh no. Oh no.
Oh, my stomach. You just don't want to take that test.
Sharp objects like that can lacerate the esophagus, perforate your stomach, perforate your bowels or your intestines. Go to the hospital, get an x-ray, and see if it's somewhere where a gastroenterologist could actually go down with his camera or his scope to be able to get it out of there.
Don't worry, son. You'll be fine. This boy's appendix is inflamed and about to burst, which will make it easier to find.
Okay, that doesn't make any sense. Appendicitis, your inflamed appendix, is inflammation of your appendix in your right lower quadrant. The appendix is probably about the size of your pinky. It's an infection. So infection usually takes a little bit of time to occur. It doesn't typically occur after you ingest a sharp object.
Once I get in there.
And he's in like an auditorium so everybody can watch.
Hot dog!
Oh my gosh. Imagine you could get food at like be a sporting event.
I will count to 3 and you will be sound asleep. 1, 2, 3.
Actually, what we do when people go into the operating room or the OR and they get sedated, usually they actually given an injection of medication, something that in the family of a benzodiazepine, which actually helps with amnesia, so you don't actually remember the event. And sometimes another type of inductive agent of a sedative to just get you to go to sleep.
Scalpel.
Ah!
Oh no, he's awake.
If I fiddle with these knobs.
Oh my gosh, oh my gosh.
Pleasant gas.
Yeah, there's a gas leak.
Night, gas.
There are some people that actually have reactions to either sedatives or paralytics to where they don't work, where you actually end up being sedated and paralyzed, but the sedation doesn't work. You're basically paralyzed, you can't move, but you hear and potentially feel everything. That's messed up.
Change me back to the blissful boob I was.
I'm sorry, we don't play God here.
That's ridiculous. You do nothing but play God.
The majority of physicians and doctors out there don't believe that. They are in the job to help others as best they can. They're human beings as well. But there are always the few in any industry that think they are potentially better than others.
Look, what if we gave you the name of an unlicensed surgeon?
Oh, that would be heaven. Mo Sislak.
That's right, I'm a surgeon.
Mo, I love it. I love it. What?
Want here, appendectomy, lipo, or
What?
the sampler. That's very popular.
I want you
The sampler.
crayon into my brain.
No problem.
What?
The old Crayola oblongata.
Crayon in the brain.
All right,
Oh.
but
Deeper, you pusillanimous Pilsner pusher.
No. No, it doesn't work that way. The anatomy doesn't work that way. The only time you can get an object in your nose straight into your brain is if you have a fracture through the cribriform plate, basically, or a basilar skull fracture to get through up. It doesn't connect that way. The nose anatomy goes backwards. It doesn't go up.
all right.
Oh!
Defense.
Whoa!
That's pretty dumb, but
Oh!
Extended warranty. How can I lose?
This is horrible. Brutal, but I guess the crayon's gonna break no matter what. It's an innate object. Actually, the wrapper's probably gonna cause more infection than anything else.
Now, with my new HMO, I can provide every medical service you'll ever need under one roof. Let's go visit the optometrist.
Wait a minute. This ophthalmologist is using an otoscope with the light shining the wrong direction. So if you look, as we continue to go, in his hand, you can see the ear tip pointing in his direction.
Your son has a temporary condition called lazy eye, where one eye is weaker than the other. You'll have to wear these for 2 weeks. Menachem Begin wore a pair just like them.
Lazy eyes are a thing, and people have it. Sometimes it's muscular, neurologic, and typically it can improve. Sometimes you might need to have surgery to tighten up a muscle. Sometimes you can even see people with like a lazy eyelid as well.
That scalp's a little dry. You better see our dermatologist.
Rub a palmful of this medicated salve into your scalp every half an hour. Keep him away from open...
Dry scalp, most likely it's just either related to water or sometimes a fungus. There are shampoos that you can use.
These should help those fallen arches. Enjoy.
Interesting clogs on his feet. Typically you only need like orthotics on the inside. You don't need to have these big built up weird shoes. Sometimes if somebody has a leg length discrepancy, you can get specific shoes that might have a little bit higher sole on the outside.
Throat looks a little red. I better spray it.
Whoa.
Oh, thanks, nice lady. My voice is crazy with this brain already. Oh, I feel so much better, Mr. Medical Science type person.
Oh my gosh. So I'm hoping that was an ear, nose, and throat doctor, or the fancy word is an otolaryngologist or an ENT doc. But there's not that many sprays that we spray in the back of the throat. There are some that we use. There's a fancy name for it, but it's just called hurricane spray for numbing. You gotta really be careful with that. That can cause a slew of other medical problems. There's something called methemoglobinemia, which is a whole other crazy medical term and issue. It's pretty rare, but if you spray it too much, it messes with like blood cells. I've seen a bunch of Simpsons, but just not these specific ones. And these are old school. I love like the old, not as good cartoon graphics, but the content is really good. So I love these. And my only sign-off note is make sure if you're doing any like sport where you're gonna hit your head potentially on a hard object, wear a helmet. There's so many cool options. There's so many brands out there. I can throw a link in the description below of like different helmets that you should check out. I personally wear a Smith when I go snowboarding. But there's so many different options out there. Do you have a favorite TV show or movie that features medical situations that you want me to react to? Let me know which show or episodes in the comments below, or if I missed any Simpson scenes that I should check out for another video. As always, make sure you subscribe if you want to see more fun videos like this one, and check out my Doctor Reaction series right here to catch up on the reviews of your favorite TV shows. Thank you so much for watching, and stay healthy, my friends.